Laparoscopy in infertility treatment. Laparoscopy in infertility treatment. Laparoscopy is a surgical treatment that allows a doctor to examine the inside of the body. The doctor is evaluating the reproductive system's anatomy, including the ovaries, fallopian tubes, and uterus when the procedure is done as part of fertility testing. Laparoscopy for infertility is a minimally invasive surgical treatment in which the surgeon examines the pelvic anatomy for causes of female infertility using a telescope-like tool, laparoscope, with light and a small camera. The doctor may be able to detect diseases that hinder conception but are otherwise undetectable by examining the reproductive organs. Laparoscopy has an important role to play in modern fertility practice. It's usually done only after infertility tests have been completed or if symptoms indicate that testing is necessary. Your doctor may recommend diagnostic laparoscopy for a variety of reasons, including if you feel discomfort or pain during sexual activity. Other times, throughout your menstrual cycle, if you experience severe menstrual cramps or pelvic pain. Endometriosis ranging from mild to severe may be present. Severe pelvic adhesions or pelvic inflammatory disease are suspected. An ectopic pregnancy is suspected by your doctor, which can be life-threatening if left untreated. If a diagnostic laparoscopy reveals issues, the reproductive surgeon will often, but not always, repair, remove, or treat the condition right away. When is laparoscopic surgery suggested in an in vitro fertilization or IVF procedure? Laparoscopic surgery in an IVF procedure when hydrosalpinx is suspected, which is a specific kind of blocked fallopian tube required to be removed to improve IVF success rates. Endometrial deposits are suspected to cause reduced fertility, hamper pregnancy success rates, and cause pelvic pain. Ovarian cyst is suspected, which may hinder the oocyte retrieval, to retreat fibroid causing pain, or blocking your fallopian tubes, or even distorting the uterine cavity. Where is the laparoscopy procedure performed? A laparoscopy is a quick and painless treatment that can be done at any hospital operation theatre, any ambulatory surgical centre, and also a fertility clinic. Before the procedure, your doctor will advise you on how to prepare for it. You will probably be told not to eat or drink for at least 8 hours before your scheduled surgery, and antibiotics may be prescribed. Before the procedure, patients are given anesthetic so that they don't feel any discomfort during the procedure. After administering anesthetic, the surgeon inserts a needle into the abdomen, inject gas into the belly to make the organs and tissues easier to see. Remove the needle and using a laparoscope, insert a small camera into a small incision, make a second incision and introduce a probe. The doctor will use the camera to examine the structures in the abdomen. They will move organs out of the way using the probe. Next steps of laparoscopic procedures. Other steps may be taken depending on the doctor's findings, such as dye is injected into the fallopian tubes to see if they are open and ready for sperm and eggs to pass through. Attempting to unblock fallopian tubes that have become obstructed, scar tissue or adhesions are removed. Repairing abnormalities detected in the procedure. To execute these extra treatments, they may make a third incision in the abdomen and insert tools. The surgeon will then remove the tools and close the incisions. Recovery after laparoscopy procedure. A person will need to be monitored for a few hours to ensure that there are no difficulties and that their recovery is proceeding well. Anyone who has had a laparoscopy should be driven home by someone else. Additionally, they should have someone be with them for up to 24 hours after surgery. Benefits of laparoscopy procedure. A laparoscopy, in comparison to other surgical procedures, can assist a specialist in identifying the cause of infertility. This involves less invasive method, reduced risk of infection, lesser scars, prospect of resolving the problem during surgery, easy recuperation or recover. Furthermore, if a person is treated during the process, their chances of becoming pregnant may improve straight away.